That's another area that I'm really passionate about when it comes to maternal health, understanding, you study biology, but the genetics behind how individuals might be predisposed to diseases. Why are some of these outcomes happening? How can we prevent them? I have a very big interest in the research aspects of epigenetics related to maternal health. Things like where individuals live, the environment that's surrounding them, the air quality, the access to adequate housing, adequate and healthy, nutritious foods. A lot of communities of color live in hospital deserts and food deserts. How are those things impacting birth outcomes for future generations? There are studies that show that, within one generation of African immigrants migrating to the United States, birth outcomes are significantly worse for that second generation. So what causes that? So just better understanding what influences our changes within our genetics that impact birth outcomes is also something that I think about often.
Yeah, and I think it's worth thinking about it. And one other thing or factor that I think that underlies a lot of what you talk about is just like stress and the stress that people of color have to deal with just generally, and how does that impact genes and outcomes and things like that. But that's very, very important in considering how we're thinking about the ways to solve these issues.
Sure.
And now shifting a little bit, we hear a little bit about your background and the ages of maternal health, but broadly, what does public health mean to you?
That's a big question. To me, public health is beyond just the absence of disease. I think for me, public health is a state of like physical, emotional, social, and financial well-being for people to be able to live and thrive in the communities that they are, residing in. They have to be able to have like some level of self-fulfillment and actualization. And through their health, I think it's important for us to, like when we define health, we often look at it from like a Western lens. But for me, health is, more than that. How does the individual define health for themselves? The way that I would define health might not be how someone else defines health. And from public health, we're always looking at disease prevention, reducing the burden of disease on a community. So really public health is, how are people doing generally in their life, not just their absence of them not being sick. Are they okay financially? All of that impacts their ability to like fight off diseases, fight off illnesses. Are they eating nutritious foods? If someone doesn't have a grocery store that stocks produce regularly, they probably won't have a lot of produce in their diet. Sometimes there are landfills near people's homes. How does that air pollution impact their overall health? Socially, are people isolated? COVID, we saw that a lot. There was an isolation epidemic. People were like loneliness epidemic. People were isolated. They were missing human contact. That has a negative impact on their mental well-being, which in turn has an impact on their overall physical well-being. So
Absolutely. And maybe digging a little bit deeper into this and like your personal lived experience of being a refugee immigrant, how does that impact your perspective, or how do you come to the public health week with that perspective?
I think of it as living in two worlds at any given time. On one side, it has given me a genuine appreciation for understanding people's cultures and really empathizing, putting myself in other people's shoes and seeing, what causes them to have like a certain perspective on a condition, or the way they like hypertension. We could talk about like high blood pressure, the way it's defined by other communities. Things like depression, stress might not necessarily be associated with that. And I think about like my immigrant refugee, like my family, like where I come from. People don't necessarily make those connections. So that's like one big benefit of being able to think in two worlds at any given time. And then more broadly, there's a lot of health challenges that immigrant refugee populations face, whether it's access to resources, limited financial capacity, getting access to healthcare facilities. There's the language barrier, there's cultural barriers. And that's something that I try to work towards bridging, really creating understanding between public health institutions, agencies, organizations, and the communities that they're serving.
So you got your bachelor's degree in global studies and a minor in public health at the University of Minnesota. Walk us through that process.
In college, I changed my major, I think 3 times within the first 3 years. So each year I was trying to study something new. And
What did you go in with as?
education. So I started off in the College of Education and Human Development. I wanted to be a teacher. My dad has a background in education, and that's all I was ever really familiar with. I thought it was amazing. I loved working with students of all ages. So I thought, let me do education. But while in the program and taking my generals, I started taking like more humanities classes and more biology classes. And that kind of inspired me to maybe rethink my original decision, because I was really leaning heavy towards like the humanities, understanding different cultures. I grew up in Minneapolis. Minneapolis is a big city. It's the biggest city in Minnesota, but the community I come from, it's kind of small. But I've always been like a global thinker. I loved, connecting with different people. I loved the idea of traveling at a young age. So when I discovered that there was a global studies major, I was reading the course requirements, what it took, what it required, what the different tracks were. And that's kind of where I found my natural fit. I think that brought together like the learning and the teaching piece. I could do so many different things with that. I could even go back to teaching if I pursued that. I could pursue, public health, which I would eventually realize is my passion. And then that led me to also do a public health minor.
And how do you get into the like public health minor?
I did a program through the university. It was called Health Ambassadors. They had a partnership with a hospital, and students could volunteer on different projects. For the Health Ambassadors program, I would volunteer at a community site where they did health education for Somali elders. They would do blood pressure screenings. They would educate them about, medication management. And then they had some like innovative therapies. They would do things like healing touch, and they would do exercise classes for elderly people who are English is not their first language. And as a volunteer, like seeing public health work on the ground really inspired me. And as soon as the semester started back up, I ended up declaring a public health minor and kind of deciding this is what I wanted to do. I saw that, the same people kept coming week after week to the same community site. And the way they interact with the nurses, the massage therapists, the pharmacists, it was truly inspiring.
Love that, love that, and I'm glad that you're able to come on and share that, because as we shared earlier, like I didn't learn about public health until late into my journey, and I wish that I was able to get exposure and know the word for it so that I would be able to maybe streamline that process a little bit. But nonetheless, we are here, and that I think that that's the beauty of people's journeys. Is like there's no one way to get and do the work and find your way into public health.